Okay, so let's continue. So I just mentioned about the resting state of accommodation, and here are some of the details. Okay, let me just show you. So the resting state or resting point of accommodation is also known as the tonic accommodation. Okay, so tonic accommodation, it means that the when you look at a distant objects, okay, so and although it is at distance, presumably it will not trigger any accommodation, but um, because when the objects, particularly when the objects are not very clear to the patient. So let me give you one example. For example, if you ask the patients to look at like a pond light, okay, sometimes if you ask the patients to look at the letter chart, it will be better because the letter chart present a very clear target to the patient. For example, the target are usually black letter printed on a white background, okay, just like my PowerPoint slide. So they are having like a high contrast. In that case, it will help control the accommodation in a better way. However, if you just ask the patients to look at like a spotlight or a pond light source, sometimes they cannot control the accommodations very precisely. In that case, the eye will actually shift to the tonic state or tonic points of accommodation. And as I mentioned, this point is usually around at about 1 to 1.5 diopters of accommodation. Okay, and this also reflects a basic muscle tone of the ciliary muscle. Um, um, and that's why we call this tonic accommodation. It's referring to the muscle tone of the ciliary muscle. So meaning that even without the accommodation stimulus, so the muscle will still have like a normal tone, has a little bit normal tone, and that's why they will still have a little bit of contraction. Okay, and that will trigger a bit of accommodation. Tonic accommodations could be affected by many different factors. So here I just want to name some of them. Okay, for example, like age. Different people with different age will have different amounts of tonic accommodation, refractive error, okay, and also the pupil size. So I will illustrate a little bit maybe on the pupil size as well. Okay. So I hope you remember these diagrams that we just talked about before our break. Is a relationship between the accommodation response as a function of accommodation stimulus. And remember, this one should be one-to-one. And but in practice, so we find that so we have this like a S-shaped curve. Okay. For example, in this situation, so we put like a 2 mm artificial pupil in front of the patient eye. So we put like a 2 mm pupil in front of the patient, and then what you can see is that the for uh, for the distant side, for example, here, you can still see the accommodation leak here a little bit. And for the accommodation lag on the other side, when the patient is looking at near objects, we still have some accommodation lag, a little bit difference between the response, the expected response, and also the one determined from the experiment. So, and if you